Childhood is typically a time of carefree joy, where adults shoulder the burdens of life. However, some children confront challenges beyond their years, making their unique conditions all the more inspirational. Prepare to be moved by these remarkable stories. Abby and Aaron Delaney, conjoined twins, are bound by more than just siblinghood. Their condition, Craniopagus, means their heads are fused together. This rare occurrence, arising from a partially split or divided fertilized egg, happens only once in 50,000 to 100,000 births. Less than 2% of these cases involve a connection at the head. Abby and Aaron shared not just the tops of their skulls, but also a vital brain vein, the sagittal sinus, making separation a risky procedure. Yet, after an 11-hour surgery and extensive treatment, they emerged as two healthy, happy, and distinct individuals. Imagine seeing the world through Mahendra Ahirbar's eyes. His condition, congenital myopathy, a muscle disorder present from birth, caused his muscles to be thin, weak, and underdeveloped. This condition affects approximately 1 in 25,000 people, but Mahendra suffered from an extreme variation. The weakness in his neck muscles prevented him from lifting his head, leaving it hanging at a 180-degree angle. This also affected his arms and legs, making walking impossible. His family had no choice but to transport him in a basket. In 2016, surgery implanted a metal rod in his neck, allowing him to see the world correctly. Sadly, he passed away 8 months later. Katie Renfro's mysterious medical condition defied doctors' understanding. While still in her mother's womb at 6 months, doctors discovered she would be born with Megalencephaly, a disorder causing overgrowth of the brain, making it significantly heavier than average. After birth, Katie displayed unusual symptoms not typically associated with this condition. Doctors remained puzzled by her enlarged face, frequent seizures, and inability to walk or talk. Despite undergoing numerous painful surgeries, including those to reduce the size of her cheeks, tongue, and ears, as well as brain surgery, a diagnosis eludes them. This rare condition is so unusual that doctors may ultimately name it after Katie. Despite the uncertainty, her family remains hopeful. Versatia, Boran Gonzavara's heart beats on the outside of her chest. Her condition, Pentalogy of Cantrell, is a congenital defect that can affect the development of the sternum, diaphragm, heart, or abdominal wall. Versatia's case, Ectopia Cordis, is one of the most extreme forms, with her heart forming outside her chest cavity. This rare condition, occurring in only 5.5 out of every 1 million live births, is often fatal, with a survival rate of just 5% for affected newborns. Versatia's survival against these odds is remarkable. The complexity of her condition has led doctors to rule out corrective surgery for now, but this braveheart little girl continues to live life to the fullest. Adalia Rose, a YouTuber, appears wise beyond her years, but she's only 13. Adalia suffers from Progeria, a unique genetic condition causing rapid aging. This means that while children with Progeria appear normal at birth, they develop aged-looking skin, limited growth, and prematurely hardened arteries. This hardening and narrowing of arteries gives individuals with Progeria a life expectancy of around 21 years. Despite her body's accelerated aging, Adalia enjoys typical childhood activities like gaming, recording TikTok videos, and getting her nails done. Parents often joke about wrapping their children in bubble wrap to protect them, but in Zoey Lush's case, it's not a bad idea. Zoey suffers from Osteogenesis Imperfecta type 3, a genetic disorder causing increased bone fragility, low bone mass, and susceptibility to fractures. The slightest bump can cause a break. Even in the womb, doctors detected multiple fractures in her tiny body. While the prevalence of Osteogenesis Imperfecta is estimated at 1 in 10,000 to 20,000 births, the number of type 3 cases is unknown. Despite the pain and constant fractures, Zoey continues to smile, demonstrating incredible resilience. Abby and Brittany Hensel, dicephalic parapagus conjoined twins, share a body. Fused side by side at the pelvis, they have 2 heads, 4 to 7 limbs, and share most vital organs. Their survival beyond 24 hours was a long shot, with only a 1 in 30 million chance. The separate development of their upper bodies made their survival possible. They have 2 hearts, 2 spines, 2 sets of lungs, and 2 heads, allowing them to control their respective halves of the body. They navigate life with double the fun, coordinating everything from walking to drinking. They take tests separately, have distinct interests, and even hold separate driving licenses. In 2009, Lang she gave birth to a baby boy in Hunan province, China. Hours after birth, she pleaded with doctors to let her see her son. When they finally granted her request, she was stunned. Xiaowei Kong was born with a bilateral transverse facial cleft, meaning the front of his skull hadn't fused properly. This left him with 2 large gaps spanning from his mouth to his ears, giving him a masked appearance. This condition affects 1 in 60,000 to 1 in 300,000 live births. In 2010, Xiaowei Kong's story garnered widespread media attention, raising 400,000 yuan, about $60,000 at the time, for life-changing surgery. He underwent 2 successful operations, with initial results looking promising. His family was told it would take 10 years to see if his facial bones would grow normally. However, by 2015, the gaps on either side of his face were gone, and despite a slight deformity, he appeared happy and healthy. Jackson Buell was born with a severe brain abnormality called microhydranencephaly, meaning his brain stopped forming a few weeks into the pregnancy. This rare hereditary condition affects less than 1 in a million children at birth and has no cure. Jackson was missing approximately 80% of his brain. Doctors initially told his parents that he likely wouldn't be able to see, hear, or talk, as those functions were thought to be controlled by missing brain areas. But defying the odds, Jackson could perform all these actions, albeit with limitations. It seems those brain areas were present but significantly smaller. He lived a happy life full of love and support until he passed away at 5 years old. In 2017, baby Chenko from Japan was born with an unusual feature: a full head of hair. By 4 months old, it had grown into an unruly quiff, and by 6 months, while most babies were just sprouting their first curls, Chenko's parents had to give her regular haircuts. Her glorious hair took the internet by storm, earning her over 340,000 Instagram followers and a commercial for Pantene hair products by the time she was 1 year old. While the exact influences on baby hair are still a mystery, a 2006 study linked the severity of a mother's heartburn during pregnancy to the amount of hair their baby was born with. 4-year-old Victoria Kamada faces a challenge far greater than keeping up with tech trends. She has bilateral tibial hemimelia, a condition severely affecting her lower limbs. Both her legs were bent backwards. Expensive surgery was the only way to save at least one leg. After raising $234,000, she received miracle treatment that enabled her to walk for the first time. The first 9-hour operation inserted pins into her left leg while amputating the right leg above the knee. A second surgery fused the bones in her left leg to strengthen it, allowing Victoria to take her first steps with a prosthetic leg. This little champion can now walk, run, and play thanks to the life-changing surgery. Cyanomelia, also known as mermaid syndrome, is an extremely rare congenital disorder characterized by anomalies in the lower spine and legs, causing them to be partially or fully fused together, resembling a mermaid tail. This occurs in only 1 in 60,000 to 100,000 births. One of those cases was Milagros Cerrone, born in Peru in 2004. Her legs were completely fused from hip to ankle, and she only had 1 fully formed kidney. While many babies with this condition die within 5 days, Milagros miraculously survived. She underwent numerous surgeries to separate her legs and went on to walk and dance, living a happy life. Sadly, her chronic kidney problems led to her passing in 2019. Rama Haruna, a bright and happy teenager, possessed extraordinary strength and grit rooted in a mysterious medical condition. Born in Kondo, Nigeria, her arms and legs stopped developing properly at 6 months old, leaving her almost completely limbless. She could not crawl, walk, or even sit upright due to her head outgrowing her baby-sized body. The only way she could balance herself was by living in a plastic bowl, which propped her into a position allowing her to eat, see, and be carried. Her family sold almost everything they had to afford medical help, but her condition baffled local doctors. Poverty forced Rama and her brother, Fahad, to beg for alms on the streets, using the plastic bowl to transport Rama. Sometimes they placed the bowl on a donated wheelchair for increased mobility. Despite her severe disability, Rama dreamt of opening her own grocery business. Sadly, she passed away at 19 in 2016. 1 in every 700 to 1,000 babies worldwide is born with extra digits, a condition called polydactyly. In many cases, it involves only 1 or 2 extra fingers or toes. But Hong Hong from China was born with a remarkable 31 developed digits, 15 fingers and 16 toes. Polydactyly can manifest as tiny bumps or firm tissue, humorously referred to as nubbins, but Hong Hong's fingers and toes were fully formed. Interestingly, his mother also has polydactyly with 12 fingers. The condition is one of the most common hereditary limb anomalies, making Hong Hong's case not entirely surprising. Fu Wangwei appears to be a normal adolescent from the front, but a different perspective reveals a unique condition. At 6 years old, he was diagnosed with congenital scoliosis, a spinal deformity caused by abnormally formed vertebrae, affecting the curvature of his spine. This condition affects 1 in 10,000 newborns and often becomes apparent during adolescence. When Fu reached 15 years old, it became clear that his vertebrae had not only curved but had also added a few inches to his neck. He had 10 vertebrae in his neck instead of the usual 7. The pain caused by this condition was severe, leading to mobility issues. Fortunately, doctors at Chaoyang Hospital developed a surgical plan to reduce the length of his neck. Tiasatrio from West Java, Indonesia, embodies fighting spirit. Despite having no limbs, he learned to write and even play games on his PlayStation. Using his chin and part of his shoulder, he can navigate the controller with ease and write quickly enough to keep up with his classmates. His mother, Mimi, was not informed of his condition until the day after his birth. Initially shocked, she learned to adapt to his unique needs, providing him with the best life possible. These incredible children inspire us with their resilience and determination. They remind us that limitations are not boundaries. Their stories are testaments to the power of the human spirit, showcasing how even the most challenging conditions can be overcome with courage, love, and support.